everybody, it's Dr. Wise. You know, a lot of guys come into the office for hair consultations and they say, gee, I really just want this PRP stuff and I don't want to have to undergo an FUE transplant. And the short answer is that there's an appropriate treatment for different issues. And I can tell you that a lot of guys who want PRP really aren't PRP candidates. So let me talk about very, very briefly the difference between what PRP can do and what an FUE or FUT hair transplant can do for someone. PRP at its core, as many of you know, is platelet rich plasma. It basically involves us extracting peripheral blood, just like from a normal blood draw, and spinning it in a special machine. We use a special machine called the arteriocyte or Magellan system. It spins really, really beautiful PRP. You get something called 6 to 7 to 8x PRP, which is very, very concentrated slurry of platelets. Those platelets have growth factors in them that help stimulate hair growth. So the question is, well, who's good for that? Anyone with slightly thinning hair, the beginnings of hair loss, what we call someone who might have some density issues and might have what we call transition areas. And what are transition areas? Those are areas where you're starting to see some thinning potentially, but certainly there is hair there, but maybe it's starting to miniaturize a little bit. It's not as healthy, not as thick as it used to be, and they want density improvement and kind of like stop the progression of hair loss. And that's where PRPs can be fantastic. People at maybe the early stages, density issues, beginnings of hair loss, but no bare skin anywhere, nothing like that. Those are really good candidates for PRP. However, we do have some patients that come in and say, gee, I want PRP, and I want PRP to restore my hairline. I have a receding hairline, or I have some areas where I really have almost no hair. And that's really where PRP can be good as a secondary treatment or an adjunctive therapy, like in other words, with a hair transplant, but you really can't get away with just doing PRP and expect to have a significant result. So therefore, people who have receding hairlines, areas where they're completely missing hair, they really aren't going to be successful with just PRP as a standalone procedure. Remember, think of PRP as like fertilizer for the head, right? So if I'm watering plants and there's no seeds there, then I can put all the water and fertilizer there that I want, but you're not going to grow plants. So sometimes you just absolutely need to put follicles in the soil or on the scalp, just to extend the metaphor, and that really makes the bigger difference. So people that have receding hairlines or hairlines that they want to reconstruct, that are a little farther advanced in the hair loss journey, people who have crowns with absolutely no hair, stuff like that, they really are better off using their resources and their treatment options for an FUE or FUT hair transplant, because what we're doing is we're literally putting follicles in the area where they really have no follicles. So I liken myself a little bit to a farmer, and that's why we kind of use that fertilizer and seed analogy. But I think it's apt when you're talking about PRP versus a hair transplantation. The only way to find out for sure is obviously to give us a call. Happy to see people and evaluate them and kind of tell you what I think might be best.